Good afternoon. Thank you for joining us for today's webinar, Mock OSHA Self-Audit. I'm Wendy Johnson with the Pennsylvania Healthcare Association. Before we begin, I have a few housekeeping items to cover. PHCA offers monthly webinars to members to receive updates from department staff on regulations, learn from industry experts on current trends and practices, and to gain a better understanding of practical application tools to equip you so that you may continue to provide the highest level of quality care possible. This webinar is being recorded and will be made available on the PHCA website. The webinar has been approved for 1 continuing education credit for PHCA members. Credits will be uploaded to NAB within the next 2 weeks for those who have provided us with your unique NAB number. And I will be sending attendance certificates as well. A survey will be launched at the close of the webinar. Your feedback is important to us and our speaker, so please take a moment to complete the survey. All attendees will be in listen-only mode. However, throughout the presentation, please feel free to submit your questions using your questions pane on the right hand of your screen, and our presenter will address them at the end of today's presentation. Today's webinar is being presented by Gordon Smoko, Senior Risk Manager with Brown & Brown Insurance. I'll now turn the webinar over to Gordon.
Thanks, Wendy, and welcome everyone. It's a pleasure meeting with the Pennsylvania Healthcare Association to provide training on the Mock OSHA Self-Audit. And over the course of the next hour, that'll be our topic today. And some information here on me. There's my information, how I can be contacted. And those will be available in the handouts that will be sent to you. I am Gordon Smoko, Senior Risk Manager here at Brown & Brown. And our agenda for today, our learning objectives, the Mock OSHA Self-Audit with a healthcare focus. And we're going to just introduce why that's important, go over some key OSHA compliance items specific to healthcare, the compliance assistance etool that's specific to healthcare. And I will be able to demonstrate that today with the goal of making you familiar with how to use that and its availability. Total recordable incident rates and day-away restricted transfer rate benchmarking under OSHA and how that fits into the Mock OSHA framework that you can help to prepare. Self-inspection techniques, and then training requirements. And this is all designed to assist you in trying to identify, with an eye on OSHA, items that you can possibly improve upon or come up with an action plan to implement at a future point in time. And again, this is focused on the OSHA regulations. I realize there's other regulations that apply. Today's session is focused more on OSHA. So keep that in mind as we're going through this, why we're focusing on some of these specific Code of Federal Regulations today. And again, any questions will be answered at the end of today's session. So why do we really want to be concerned about this? You know, looking at it from the OSHA citation standpoint first, I like to have just a quick summary of what the most pertinent OSHA recommendation categories are. And I pulled this information for the North American Industrial Classification System Code, which I believe many of you are, and I'll have some other information today on assisted living as well. But I prepared this and pulled the information out of the OSHA materials for 6231 nursing care facilities, skilled nursing facilities. And these are the citations that were highlighted in OSHA from October 2020 through September 2021. And just to give you an idea that what they look at there. Respiratory protection, 1901, and there were 284 citations with $900,000 penalties incurred there. And then COVID, of course, was in there with 41 citations and $143,000. But more importantly, also there's a lot of other things, and this was in the time period that they had available within OSHA. And of course, the pandemic has a lot of the respiratory protection in the new COVID subpart involved in their citations, but they also had a lot on general record keeping with 31 citations, bloodborne pathogens, serious injury and fatality reporting, personal protective equipment, hazard communication, walking working surfaces, wiring components and electrical, lockout, tag out, and they utilized the general duty clause. And again, this was just for one NAICS code, and you could pull that for a lot of different NAICS codes if you are not within that particular code. And the reason this is important is as you're going to do a mock OSHA, you would want to know what is OSHA most concerned with. And this gives you an idea here. And this will tie into some new information I have on some of the COVID initiatives that have come up in the last couple of days by OSHA that you would want to be aware of, since you're trying to prepare against any type of an OSHA inspection. So this is the types of citations and the penalties that can be involved there. And so that's something you always want to, get the book out and make sure that we know where we are with those. So then give you an idea also from an introduction, the 2022 OSHA citation penalties they're on now a inflation adjusted increment. They used to be very low penalty maximums, only a few $1,000s. Several years ago, they revised that, and they're increasing now with inflation. So for a serious violation, although the minimum is $1,036, it can be upwards of $14,000. Other than serious, it also can be up to $14,000. Willful or repeated, though, can be 10 times that, $145,000. And that will be important if you've ever had any history of OSHA citations at your organization. Posting requirements as well. We saw that in the citation cited for the skilled nursing facility North American Industrial Classification Code, that's cited very frequently. That can be up to $14,000, and failure to abate a citation as well. So these, the reason that from an introduction standpoint, these are the latest penalty amounts, and something that it can be taken, it can add up to a lot of money, and it should be taken very seriously. So some of the key OSHA compliance items for healthcare, and you'll see in a moment as we're working through the program where we get these from. But what we're going to be focusing on are obviously the key ones that we're all familiar with: hazard communication and bloodborne pathogen. But some of the less thought about ones, and we'll show you how you can self-inspect and do a mock OSHA self-audit on this in today's program. Also, ionizing radiation standard, if it may apply to you in some settings. Exit routes standards, electrical standards, emergency action plan standards, fire safety standard, medical and first aid standard, personal protective equipment, and then the general duty clause. So these are the key ones that I will be going through with the OSHA etool, the key categories, and I'll show you these are the ones that OSHA highlights. And we'll show you how you can identify that by using their etool. That is one of our key things today that we want you to be able to become familiar with and be able to utilize in your internal mock OSHA process. And for healthcare, one of the things here that we're all aware of, on June 21st, OSHA adopted a healthcare emergency temporary standard protecting healthcare workers. And under, again, the respiratory protection standard, they issued those 284 citations during 119 inspections with around $900,000 in penalties. And the COVID ETS, they issued 41 citations during 16 inspections, totaling $143,000. And that was all for the nursing home NAICS code. And importantly, this is where it's going to get a little bit confusing. We all are familiar with the fact that on December the 27th, 2021, OSHA announced that it was withdrawing the non-record keeping portions of the healthcare ETS. However, the COVID-19 log and reporting provisions remain in effect. So one of the handouts that I'll be providing today would be the COVID log handout on how to prepare that COVID log. That was part of the ETS that has gone away, but you're going to see that they're making some efforts to bring parts of it back as we progress through our session today. Key takeaway here is that COVID log is still in force. We have a lot of Health and Human Services clients, and they thought they were going to be able to abandon doing that. You cannot. You need to continue to complete that COVID log per the OSHA requirements. And at that point in time, they stated that they were going to work expeditiously to issue a final standard that will protect healthcare workers from COVID-19 hazards. While they haven't gotten there yet, they have come close, which you'll see in just a moment. So this is how things have progressed on that part of OSHA in the last couple of months. And this is what we're talking about here. From that emergency temporary standard, you are probably familiar with this form that they required, the COVID log, with the employer's name, employee contact information, work address, most recent day in the workplace, and the COVID diagnosis, positive test date, and tracking that. So if you haven't, OSHA withdrew that non-record keeping requirement. However, the log is still in force. And we will be providing the fact sheet handout on how to prepare and conduct and complete the COVID log with today's program. And there's a link to the, if you want to look for that right there. But since, and this is something that is only come up in the last 2 days, and this is really maybe one of the more key things, from a COVID standpoint that we'll be going over today, is there was a news release on March 7th, 2022 by the Department of Labor, OSHA. You may or may not be familiar with this yet, and it hasn't really gained a lot of prominence in the public eye yet, but you need to be aware of it as someone involved in your industry in healthcare right now, because the U.S. Department of Labor announced that an enforcement effort, they don't have a new standard yet, but they have an enforcement effort for focused inspections in hospitals and nursing care facilities treating COVID-19 patients. And OSHA intends to expand its presence in targeted high healthcare facilities during a 3-month period starting, and this just came out 2 days ago, actually starting today, March 9th, 2022, and running until June 9th, 2022. And what that is for the following 4 NAICS codes: 6221, general medical and surgical, 6222, psychiatric and substance abuse hospitals, 6231, nursing care facilities, skilled nursing facilities, and 6233, assisted living facilities for the elderly. So what that facilities having that NAICS code who meet one, they're going to focus on ones that were a COVID-related citation, or they had a report, or somebody called OSHA, an employee called OSHA, and they've had a complaint, and they're going to focus on those first. But then they're also going to be doing random selected remote inspections, then focus them down on site inspections. So if you've had any one or any file a complaint, if you've had to respond to any COVID issues to OSHA during the pandemic, they're going to be circling back to those folks first. From what I understand from talking with some of the OSHA people, they're developing a plan of action on this as well. This came out rather quickly for them as well. And it was all because of the OSHA ETS for healthcare went by the wayside, and then the general public, general industry ETS was found that it couldn't be implemented in the courts. So now they're trying this approach. So it's something that you would want to be aware of, and that link is live in the handout that we'll be providing you in that trade news release. So they have it also as of today. I checked. It is on, if you go to OSHA.gov, it will be right on there as soon as you launch their OSHA page. So if you're in those NAICS codes, 6221, 6222, 6231, or 6233, just be aware of this situation. So thought I'd pass that along, and that's a recent update on where we are with that. So getting to those key elements of the mock OSHA and how do you go about doing it, knowing that these tools are available. They have one specifically developed for the healthcare industry. It's called a Compliance Assistance Quick Start. And as you can see here, it's stepped out in step 1 OSHA requirements that apply to many healthcare employers, and then step 2 other hazards at healthcare facilities, step 3 survey your workplace for additional hazards, step 4 find information about specific healthcare sectors, step 5 develop comprehensive programs, step 6 train your employees, step 7 record keeping, reporting, and posting, and step 8 find additional compliance assistance information. This is their effort to try to help you, do your own mock OSHA and stay in compliance, because at the end of the day, that's what you really are truly trying to accomplish. Well, you're trying to make people be safe and not get hurt at work, number one. But when you're doing a mock OSHA, also you want to find out if you have any gaps that you're missing and need to fill in to make sure that if you get an OSHA visit or complaint, that you have everything in order. So how we can help you accomplish that is, let's just take a quick look at this website. And as you'll see here, and let me see if I can show you this a little bit here. As you see, it's stepped out. The OSHA requirements, it's very user-friendly for the hazard communication standard. And again, this is it's specified for the healthcare industry. So they'll focus on these key items here. So everybody's familiar with GHS and globally harmonized and the training. And we'll talk about that at the end of today. The requirements there, I'll give you a summary on that. Again, this isn't only an hour-long program today. We can't cover everything, but this is how you can go about it. Have your safety committee or have your health and safety team work through this tool. And if you're familiar with this tool, that's half the battle. So it'll actually have little fact sheets very nicely laid out that are specific for healthcare. And then number 2, this is ones that apply to many of the bloodborne pathogens, the ionizing radiation, if you have x-ray equipment or other equipment that's used on site. That's something you might probably may or may not have, I don't know, but something to be aware of and rule in or rule out when you're doing your own mock OSHA. If you need to investigate that. Then the exit route standards, knowing that you're up to speed on that. And I know this is different. You have all the other moving parts with all the other titles and regulations that apply and all the other people that inspect it. This is what you need to be doing for them as far as design and construction of exit routes and what standards apply. And I'll give you some checklists that you can work down through as well today. But this is where you get the key information. And electrical standards as well are covered, and an emergency action plan standards. And they have an etool that you can launch there, and it'll actually help you develop your own emergency action plan internally. And then fire safety, which of course in nursing, skilled nursing is a big area, and you're well versed in that. But what they require with the portable fire extinguisher training and things like that. The first aid standard, what's required there, and personal protective equipment. And that's been probably the key topic with the pandemic and respiratory protection for healthcare. What's currently all the information, and we don't have time to go into it right now, but KN95s versus N95s, Appendix D, when does, within an hour we can't cover all that, but when do you need to be doing fit testing and training, at what point in time, and how does that apply? That's going to be covered in there. So, and again, the general duty clause, which I mentioned, even though it's not exhaustive list here, they can always bring another standard in by reference. But then you would go to your other steps here. They will incorporate the workplace violence, and even though there isn't the first step, there's genuine standards that they can cite you on. These ones, this is from their website. This is OSHA's website, and what they'd like to see you working on as far as ergonomics with back strains, workplace violence. They're working on developing a standard for that, slip, trips, and falls, influenza, tuberculosis, emergency response, chemical hazards, and what you might have in the workplace there with sterilization, with different ethylene oxide and things like that. That you have to work down through all these things, but this is specific to healthcare, and roll it in or roll it out for your location. Latex allergies and other things that you might need to be aware of. But then with the step 3, surveying your workplace, and I'll be summarizing these because this is kind of what I use then as a mock OSHA approach, the way I was trained initially, and we'll summarize these for you. And finding out information where you can get other information, and develop a comprehensive plan if you have a gap that you need to fill, in training your employees, what you need to do there. And I'll summarize a lot of these things in the next slides. And then very importantly, the record keeping and reporting, which I'll hit on, since you noticed in the beginning that there were a lot of penalties and citations related to that with the OSHA posters and your OSHA 300 logs and your electronic reporting, with the new requirement to upload that data electronically by March 2nd of each year. So that is, and then it has other compliance assistance information. So that, familiarizing, that was one of our goals today, to go over that. And again, in the slide deck that will be available to you, that link is live, it'll take you there. But I'd encourage you to have your team work that tool and see what you can glean from it for your workplace. And then the other hazards that we saw in there, the ergonomics, the workplace, the slip, trip, falls, influenza, tuberculosis, emergency response, chemical hazards, lasers, latex, compressed gases. They can bring those in by the general duty clause. That first slide with all the ones that HAZCOM, bloodborne pathogen, there's definite citations they can give you on those. These ones they can work in through the working standard, even though it might not apply. They can make it apply if they want to your environment by using the general duty clause. And that's the reason OSHA included that as one of the steps in their OSHA compliance assistance tool. So that's something that you need to be aware of there and get your arms around in order to be able to do a good mock audit, self-inspection. So another thing that you need to have a good idea about in order to be able to do a good self-inspection, self-audit, is to know what the DART and the day away, restricted, transferred, and total recordable incident rates are for your facilities for the past number of years, and what the industry overall is. If you've been following OSHA at all in the last 5 years, you'll notice that they have been increasing their use of data considerably, and how they're doing that is what they call the ITA, the Internet Tracking Application for Electronic Reporting. They have a system now where probably many of those attending today are reporting that, maybe doing the reporting themselves through the injury tracking application on the internet and doing their own electronic reporting. But it's no longer something that the data is available to them and they're able to come up with rates. They always have in the past. They've always been doing it on a random basis, but now they're collecting the data electronically and using this data to sift through it a lot more. So your DART rates, your total recordable incident rate, is becoming public to OSHA on an annual basis. And so you need to be aware of that and track it yourself as a key element of doing your internal mock OSHA self-audit, because these are key rates OSHA uses for safety performance comparisons during inspections. So you should be aware of it as well. They use these to do their targeted inspections for their national emphasis programs and their regional emphasis programs. And also in that slide I mentioned about the March 7th initiative for some of those locations, they will be mining that data to find out if you're an outlier, have a much higher than average DART or TRIR rate, then you probably are going to be in that category where if they have the time to get to you between March 7th and June 7th, that they will. So it all starts by knowing where your rates are. You may already know that, and if you do, congratulations. It's one of the first steps in knowing how you benchmark against your peers in the industry, because these DART rates and TRIR rates are generated for each specific North American Industrial Classification Code, that NAICS code. And we'll run down through one for skilled nursing today to give you an example of it. But if you're not familiar where you get this data from, each year you're required to post a summary of your OSHA recordable injuries and illnesses, and that's that time period now from February to April 30th. And how you can gather the data to do your DART and TRIR rates are simply right here where the arrow is pointing. We have columns H, I, and J summarized from the actual 300 log. Those numbers are then just rolled up and in aggregate put on this annual summary, which you're required to post on the employee bulletin board. And so we're going to be using to develop the DART and TRIR rates only where you can see it. It says H, I, and J. The only other piece of information you need off this form to do a rate is the total hours worked by all employees last year, which is also listed. So all the data is already available on the bulletin board in your workplace to be able to develop your own rates. And that's where you can obtain that information from first and foremost. So what does that calculation look like? The DART rate And it makes some sense of this. It's very, very simple. It's just think of 200,000. Why, they have number of occurrences divided by the employee's hour worked, multiplied by 200,000 hours. It's just a ratio. 200,000 just represents 100 employees. Think of a standard work year being 2,000 hours, and that's how they look at that by 100 employees. So what this does is effectively be able to compare an operation that has 50 employees with one that has 500 employees on a ratio basis. So once the rates that we'll look at for skilled nursing can be applied to a facility of any size by that given rate. So all you merely do is it's just a total of columns H and I that we just saw on the 300A. You just add those two column things on your OSHA 300A that's out wherever it's posted, or you have availability to it. Multiply by 200,000 hours, divide by hours worked, equal your DART rate. And here's an example. Let's say we have a nursing care facility, skilled nursing facilities, North American Industrial Classification System code 6231, worked 448,323 hours. Good sized facility, but not extraordinary. Many of you probably fall in somewhere into that category. Maybe some larger, maybe some larger, maybe some less. But let's say for that particular location, facility, there were 15 lost time cases and 23 restricted workday cases recorded on that OSHA log and on the 300A, H and I. And the DART rate calculation would be, H is just the lost time, I is just restricted time. 15 plus 23 equals 38 cases total times 200,000 hours over 448,323 gives you a DART rate of 15.2. And remember, this is day away, restricted, and transferred. The reason OSHA likes to look at that rate is because it's a true measure of safety, because if anybody was injured bad enough that they missed a day of work or they were restricted from doing their normal job, that's a significant injury. And in comparison to the TRIR, which is all OSHA recordables, which is anything beyond first aid. So they didn't have to miss work, but that's another rate that that they have. But this is, and the calculation is virtually identical. Just we'll show you in a moment. There's just one small variation to that, but you can easily do this for your workplace. And I always advocate this: know it for your most recent year, and then maybe your 5 previous years. And why is that important? It's because that can be the data that OSHA is looking at before they arrive at your doorstep. So you want to be aware of it. And if you are new to your organization, you want to know if you had a DART rate that was an outlier maybe 3 or 4 years ago. So begin building that history internally of what historically has my DART rate been, and as we're going to show you, how you can compare it to others in the industry. So then, so the DART rate, the Bureau of Labor Statistics compiles this data each year. They've got that new injury tracking application on the internet with electronic reporting, gathering the data too. Sometimes, so there's data mining, and a link is available to BLS if you want to find that data, and it becomes available every October, but it's always a year behind, because they will be developing the 21 data, won't be available till October of 22. Well, here is the TRIR and DART rate information for nursing and residential care This just 623, it stops there, but then you can see nursing care facility, skilled nursing is 6231, which is the example I'm using, but then also residential, intellectual, and developmental disability, mental health, and substance abuse facilities 6232. You can see how their numbers are there. Continued care retirement communities, assisted living for elderly 6233, you may fall under that, or other residential care facilities 6239. Whatever NAICS code you fall under, you just merely go across, and the total recordable incident rate, for instance, we're using the example of skilled nursing, is in 2020, in the 2020 calendar year, the last year that they compiled the data, 15.7. What that means, there were 15.7 OSHA recordable injuries for every 200,000 hours worked in that calendar year for NAICS 6231. So that means, that gives you a rate there. Likewise, 13.5, that includes days away, restricted, and transferred. So that means there were 13.5 lost time or restricted time injuries for every 200,000 hours worked. Think of it as every 100 employees. 13.5 day away or restricted injuries for every 100 employees, i.e. 200,000 hours in that calendar year. So that's their norming number that they go to, and that's what they track there. So for nursing care, let's say we pulled from that data, we looked at that data we just showed you, and the DART rate is 13.5. And this provides a useful benchmark, because are you better or worse than that? And it can be tracked over a period of years. Archive data is available if you go to the Bureau of Labor Statistics websites. It can be accessed through the OSHA website. They have a little link, it's hidden, but you can find it, or find the data if you Google for it, or come to me and I'll help you do that, because we do this quite frequently. But they all have historical data going back 4 or 5 years. The numbers don't vary that greatly year over year, because it's law large numbers. But another thing, that's you can see the difference there in looking at this data again. You notice in skilled nursing that there's the day away, restricted, and transferred per 200,000 hours worked is much higher than some things like residential, intellectual, and developmental disabilities, and it's higher than any of them. And that's probably because of the back injury exposure and in the hands-on care that's not given in some of these other NAICS codes. And the rolled up number in aggregate for nursing and residential care 623 is 9.3. So, but you have to be very specific on your NAICS code. So you're not down here maybe in continuing assisted living where it's 7.9, and you might be falsely thinking that you're doing worse than average if you're using one of the numbers that's outside of your code. So you got to make sure you're using your right NAICS code. And so your DART rate, like we calculated, 15.2, and the industry average is 13.5. What should this mean to me as an administrator, safety and health manager for a health and human services organization in say, skilled nursing? So, your potential OSHA emphasis program issue depending on on that industry. Right now, as we've seen, healthcare, they have a focus on that, and they do have national emphasis programs on use. So there is an emphasis program in that industry, and it's one indication that the safety performance has room for improvement if your DART rate is higher than the industry average. And again, that injury tracking application is going to catch the attention of your local OSHA office when they filter through that. So knowing that data in advance is going to be helpful. Put you at a competitive disadvantage, because that usually reflects that you're having more injuries, which cost more. And it provides a good tool to goal set with the safety committee to get the DART lower long term. And how do you accomplish that? So, and then likewise here, just to let you know, the total recordable incident rate, again, DART is just day away, restricted, and transferred. So on that OSHA 300A, it's only columns H and I. When you just add column J, which means all the OSHA recordables, all the entries that year, that includes all the people that just nicked their finger and had to go and get a stitch but didn't miss time, didn't need to be restricted from their job, that kind of thing. And then that's important as well. So another thing to be aware of is what you've been putting on your COVID logs, and then what also you've been putting on your sharps logs, and for any sharps injuries that have occurred. So they will take a look at that. So mock OSHA inspection process, really, that you can look at this as a way to run through some steps. We have review your OSHA 300, 300A, and 301 in Pennsylvania. Most of our clients, and I'm sure you are as well, are using the workers' compensation first report of injury as the equivalent, and that's perfectly fine. I do an hour-long session on OSHA record keeping annually, and that has not changed, and we always do that. So again, if you can just go right to the 300A and get your information for your DART and TRIR right there, that's always helpful. But knowing your OSHA 300 as well to find out, is there any commonality? Are we having a lot of back injuries? Because they often will come in the door. Start there just like they would. The way an OSHA inspector will come in, they might have your rates, but you haven't been required to upload your entire 300. They initially wanted to do that with the ITA, with the injury tracking application, but that did not occur. They only get the 300A aggregate information. So they're only coming armed with that information. So they're going to ask to look at the 300s for a couple of years, and they look for things, commonalities in there that. So you should be familiar with that and find out if there's all back injuries or all needle sticks or all slip falls, and what have we done about it to try to prevent it, or what can we do about it. So that's kind of what they're doing as well. And then once you have that data, develop your total recordable incident rate and your DART rate. And when you're doing your own self-inspection, that's always, because that's one thing that we're trying to do a mock OSHA, what OSHA would do, and that's what they would do walking in the door. They have more access to the data these days, but many of the times, and especially if you're not subject to the ITA, which has various cutoffs for type of industry and size of the employer. So the smaller employer might not have to do the injury tracking application. So when they're walking in the door in a facility like that or an establishment like that, they might not have any data to work with, and they're just going to immediately ask you for that information and then develop the rates right on the spot. And they do come armed, though, with what is the industry average from BLS, so they know whether you were above or below average. So that's a good starting point and good information for you to be armed with, that what they're looking at. So then identify the general safety and health hazards and controls in the workplace. And there's a variety of ways you can do that. Review records to find your loss runs, insurance loss runs. We do that a lot here at Brown & Brown, where we do that for customers, where we try to sift through the information, especially the larger clients, and find out what they need to work on. Walk through inspection, and then that points you where to look. If we're having a lot of slip falls, why? If we're having a lot of back injuries, why? Does our program need to be strengthened? Walk through inspection, just what do you see there, and then also what do you hear when you're walking around out there from the employees? Know your OSHA inspection history. Go to the OSHA website here. Again, this link will be live in the handout. You can look up your establishment, OSHA established, called an establishment, your location's information, as if there's ever been any. You might be new to your organization, but you might have had a OSHA citation 10 years ago, and you would like to know that, and so that you can. That's where that in the beginning, that willful repeat elevated penalty is possibly exposed. Is that if the bloodborne pathogens citation was given, and then they come back and it's given again, you might go beyond the $14,000 serious. It might go into a willful category. And then interview a small number of employees in private to determine employee and awareness and knowledge. They will actually do that. They have the right to do that. They will ask them to find out, do you know about bloodborne pathogen? Do you know about HAZCOM? Your fire safety training, have you been trained on portable fire extinguishers? What kind of training have you received? And so, you can do this as a team and involve everybody as much as possible. And then review the records and the programs and hazard assessment, emergency action plans, hazard communication programs, lockout training, respirator training, fire safety, fire extinguisher training, bloodborne pathogens training, respirator protection training, and temporary employee accident records. Making sure that if you're have temporary employees there, that you're coordinating with the temporary company on who's in control of this employee and who's managing them safety-wise, because that can play a role there, because you got to make sure that the temporary employee is not forgotten about. And he actually, if you're managing him, he goes on your OSHA logs, commonly overlooked, but his injury is on your OSHA log. And if you're managing that person day to day and supervising them day to day. I like this slide here. I pulled this from OSHA. Again, you can pull it up through the link, but it gives a good, from a nursing home wing, covers all the lifting, chemical, hepatitis B, bloodborne pathogens, or TB exposure, potential health hazards, workplace violence, heat stress even, and calls out where they might be in a wing A, wing B, at a nursing station. But it doesn't forget about dietary, laundry, maintenance, the boiler room as well, as far as potential hazards, as far as slips and falls, electric shock, PPE, burns, machine guarding, and egress. And that's something that if you go to this website here, this is something that is chock full of really good information. Nursing home and personal care facilities, the web page, a lot of good stuff here. That link in there on right, you can work down through that on a lot of good information here on how to control things with bloodborne pathogens, needle sticks, slip, trips, falls, MRSA, everything else in there as it relates to things. And again, this is OSHA, and another tool that they have, and that link is in there in this slide here. So that in and of itself, you could do an hour long on just that one web page. But I encourage you to go there and do your hazard analysis with potential hazard for your workplace based on that. And then the mock OSHA inspection process, do the walk around, document apparent violations with photos, check for posting of the official OSHA poster, which we have in the right-hand corner here. That's got to be up, and use a checklist approach. You can use the small business guide from 2021 as one tool, and I have that if you need that. And the OSHA etool we went through is a great guide, because that's focused on healthcare, where the small business guide is really kind of general. And of course, you'll leverage your safety committees, the PA Safety Committee Manual, and I'll have that as well if you don't have that, if you don't have a certified safety committee. But those are generalized checklists. The one that one I showed you, that OSHA etool, is a great guide to start with there. And then finally, evaluate your results, compare your TRIR and DART rates to your peers through that benchmarking, through the BLS numbers, identify records program areas that need to be improved, and then develop a plan to improve them. So the normal approach to that. And then we'll just finish up here in the last 4 or 5 minutes with some of the training requirements. Bloodborne pathogens, these is something that they're going to inspect on. We're very familiar with this. All employees, occupational exposure, when employees need to be trained, initial exposure, and very specific training records must be maintained, dates of the training, trainer credentials, everything's got to be kept on that. But then respiratory protection, that's been a big issue. And even though that's evolving, this still stands under 1910.134. No specific training documentation was required, but a lot of these things here that I'll go over in the next upcoming slide, they might say that no specific documentation was required, but I've always been trained that it's best to keep a sign-in sheet and some form of documentation that the training has been conducted and provided. And then hazard communication, even again, the requirement says all people have to be done. There is no annual requirement, but the no documentation requirement. However, I would think that since you do the training, you want to document that as well. And then some of the other ones, the emergency action plans, there's no specific one then. It needs to be done initially, and when any changes are made. and likewise with the fire prevention plans. And so you should be checking these boxes off that this training's been done for, this is specific to healthcare alone. And portable fire extinguishers, you guys are big on that. I do a lot of fire extinguisher training for our customers, and that everybody's got to be trained, and that's an annual one, where initially and at least annually thereafter. It's that important as a life safety tool. So I'm sure you're very familiar with that, and the requirements that you have are being met on that. And then the PPE is before being allowed to use it, and then as necessary. And again, even though no specific training documentation, keep training documentation as much as you can. And then ionizing radiation. This is if you have any of those X-rays, pieces of equipment there, although probably less common than might be thought of. I mentioned it here because the OSHA etool does call it out, and if they're not NRC regulated, that's who it applies to, and how they're to be trained, and it doesn't have any specific requirements on the annual, but you have to have a copy of the posting of the operating procedures available for all employees upon examination. So you can refer to that if you have any questions when that comes up. These may also apply, and again, looking at outside of just the nursing realm, think your maintenance people. Permit required, a confined space, lockout, tagout, and this is the reason that they alluded to that in that e-tool. General requirements, asbestos. These are the standards that apply for training for maintenance. And then we have housekeeping, laundry maintenance, machinery operations. There's a training standard there. Go to 1910.264. And then laboratory things like sterilization, if you use that, or anywhere, ethylene oxide, and any other hazardous chemicals in a lab, maybe less thought of, may not apply to you, but work down through this and cross them off. If you don't have the exposure and doesn't apply to you, then you're okay. And then finishing up with a quick summary here, because we want 5 minutes for questions. We've reviewed, the steps to conducting a mock OSHA self-audit. You should now be familiar with, and hopefully you are. This is what we wanted to provide. What were the key OSHA compliance items? We started off with that one slide, all those ones with hazard communication, bloodborne pathogen, but then the less thought about ones as well that are brought about by OSHA's e-tool, compliance assistance e-tool. Working down through that can be very beneficial for you as an organization, super beneficial for you to be able to do your own benchmarking on the total recordable incident rate and day away and restricted transfer rate, in developing that for internally, and marking that, and trending that, and comparing it to your peers. Knowing your self-inspection techniques that you can use, especially some of the tools there on hazard identification that I showed you through the OSHA website, and the OSHA training requirements that we covered. So that was our intention today, to cover that for you, and hopefully we'll allow 5 minutes for questions. It is 2:55 on my watch, Wendy, so we can maybe take any questions they might have and finish up before 3 o'clock so people can go on with their day.
Great. Thank you, Gordon. Thanks for sharing this information with us today. And we are open for questions at this time. Please type them in the question box. And we do have 2 questions already in, so let me get started with those while others are potentially getting their questions typed in. The first question is, please verify who may sign the annual fit test medical questionnaire. Can our RN infection nurse, or does it need to be an MD?
For the PHLCP, physician or any other licensed healthcare professional, it would be there. They go by physician or licensed healthcare professional in the code. I'll have to research that. To be honest with you, I don't want to make an off-the-cuff remark that an RN is considered a physician or other licensed healthcare professional in order to make that call. And could you email me that question? I'll get back to you by the end of the day on that. We can get that question answered.
I will do that. Thank you. The next question, we might need a little bit more context for this question. It says, what about the people out for COVID? I'm not sure if you can place that. That was around the right after 2:30 time frame.
Okay. What about the people that are out for COVID? On the COVID log, yes, believe it or not, on the COVID log, and I'll send that as a fact sheet. It doesn't matter where they obtained the COVID from. On the initial COVID log in the healthcare, they wanted people to track that on their COVID log.
Okay.
If that's the question, and I'll be providing that. It's on the OSHA fact sheet on the COVID log. With the thought being, I remember when it was a foggy period during COVID, and the thought was in healthcare they wanted to track everybody that had COVID because they were kind of it was almost like an overkill approach in healthcare, but in my opinion, it's something that they did in order to make sure that those people weren't getting back into the workplace.
Okay. We'll just give it another minute. I don't have any other questions at this time, but if anyone does have any questions, please type them in and we'll try to get to them here before we wrap up for the day. And I just want to remind everyone, we do have webinars coming up. We are scheduled currently through June, and look for new webinars coming out. We have a couple new ones that I just put into the system yesterday, so those are coming up in April and in early June. So look for those webinars. We've got some good ones coming up. We'll have Gordon and one of his colleagues back with us in the fall for a reducing of slips, trips, and falls. So we'll look forward to that and having Gordon back with us then. All right, I don't see any more questions, so just want to remind everybody to stay on to complete the survey as you're logging out. Today's webinar recording will be made available on the PHCA website, and be sure to check out more, again, of PHCA's webinars as they are currently scheduled through the next couple of weeks. I want to thank Gordon again for his time and for the information he shared, and just want to wish everybody a great remainder to your day.
Thanks for your time.
Thanks, Gordon.